Good afternoon, and thank you for joining us for this community briefing. Joining me once again is interpreter Margie Propp, and thank you again, Margie, for all your dedicated work to help get out the word about how to stay safe and healthy during this pandemic. Before we begin today's COVID-19 briefing, I'd like to take a moment to acknowledge that this week marks 6 years since the Yazidi genocide began in Iraq. Its effects on the Yazidi community here and across the world are still being felt today. We stand in solidarity with our Yazidi friends and neighbors in Lincoln, and we are so proud to be home to the largest community of Yazidi refugees in the world. We also want to take a moment to acknowledge that we lost our 17th community member to COVID-19 this week. On behalf of the City of Lincoln, I extend condolences to her family and friends, as well as to all of those who've lost loved ones during this pandemic. To keep one another safe and to access information and resources available to support our community throughout this pandemic, we encourage everyone to visit our website at covid19.lincoln.ne.gov. There you will find a dashboard with the latest COVID-19 data, and we update that dashboard daily at about this time. At our website, you will also find our COVID-19 risk dial, a color-coded tool that gives our residents an understanding of the risk level for community transmission of the virus here in Lincoln and Lancaster County. We update the dial each Friday, and today we are here to inform you that we remain in the orange portion of the dial, indicating a high risk of the virus spreading in our community. We are not out of the woods yet, and our community transmission rate is still high, higher than we want it to be, to feel confident that we have contained it. With 25,000 students about to set foot on UNL's campus, and with our K through 12 schools set to resume classes in the coming days, so much is at stake right now. The best way that we can support the ability of schools to open safely and for our local economy to recover is for each of us to pledge to support the success of the schools and our economy's recovery with smart choices and behaviors. Foolish choices will only set us back and allow the pandemic and its devastating impacts to last even longer. I'm so ready for this pandemic to be over, and I'm certain all of you are too. We are all tired of living with the weight of this invisible threat on our hearts and our minds. But guess what? This coronavirus doesn't care if we're tired and ready for it to be over. In fact, the virus is lying in wait to take advantage of that fatigue. Let's not let the virus win. Let's instead demonstrate our commitment to prevailing over the virus by protecting our family, our friends, our loved ones, and our neighbors. We know what it takes, and we know that what it takes is hard. Prevailing over this virus asks us to think beyond our own wants and wishes. Prevailing over this virus takes the collective power of our community. Be powerful. Be greater than this virus. We exercise true power over our destiny by faithfully wearing masks, washing our hands, watching our distance, keeping 6 feet from others, staying home if we are sick, and right now, while we are in orange, staying home as much as possible. We can do this, but we all need to be strong and compassionate. This is a strong and compassionate community, and I'm counting on you to do your part to defeat this virus. In today's situational update, we want to share with you that an additional 22 individuals in Lincoln and Lancaster County have tested positive for COVID-19. The total number of lab-confirmed cases now stands at 3,266. On a more positive note, our total recoveries identified to date are up from 1,403 to 1,406. We'll take the small victories. Health Director Pat Lopez is here now for a look at the main indicators that we use to determine the position of our risk dial, and I'll hand it over to her.
Thank you, Mayor. As we've mentioned before, to determine the dial position, we look at the past 3 weeks of data in 5 main areas. And I'll update you on each one of those main factors. First, we look at the number of new COVID-19 cases and what the trend shows us. The 7-day rolling trend shows the upward trend in new cases we experienced in July, as well as the decline since then. The average number of new cases was down to 38 through the end of last week. The number of weekly cases peaked at 361 the week ending July 25th. Last week we saw a decline to 310 cases, and so far this week we have 167 new cases. We are on pace to see a second consecutive week of declines. The majority of new cases are still in the age group of 20 to 29-year-olds, but there too we are seeing a decline. That age group accounted for 57% of the cases in early July, and over the past 2 weeks, that's leveled off to about 45% of the new cases. Over the last 2 weeks, we've also seen a slight increase of 5 to 10% in the other age groups. This could be attributed to additional spread from individuals in the 20 to 29 age group to family members or other close contacts. It also could be the result of the overall increase in activities and gatherings we have seen. The second factor is the positivity rate, or the percentage of tests that are positive. The average weekly positivity rate for the month of June was 4.8%, and then we did see that rate increase in the month of July to 7.3%, with a high during the week ending July 25th at 8.3%. Last week, the rate was down to 7.2%, and so far this week, we are at 5.9% for the weekly rate. If this holds true, the rate is beginning to trend lower. A third key factor is Lincoln's testing availability and the turnaround time of tests we receive for results. The availability of testing in Lincoln has not been an issue for many months. Over 48,000 Lancaster County residents have been tested for COVID-19 in Lancaster County, and 8,600 of those were tested in the last 2 weeks. To start the testing process, just visit bryanhealth.com, chihealth.com, or testnebraska.com. You do need an appointment to get tested. Test Nebraska has expanded testing to 6 days a week, and this testing is free with no billing to insurance. The Test Nebraska site is now at Gateway near the former site of Yonkers. The testing turnaround time, how long it takes to get the results, is another critical factor. As we've mentioned, this fluctuates from week to week, depending on the regional and national demand for testing. This is an area we have no control over, but delays in receiving these lab reports do impact when we can begin follow-up with people who test positive and when we can start contact tracing. The sooner we can start the process, the better, and long delays can impact our ability to prevent the development of clusters or outbreak. At the end of last week, about 75% of testing results were received within 3 to 4 days. A fourth factor is the capacity and ability of the health department to conduct investigations and contact tracing. Nursing staff from the health department still initiate contact tracing and attempt to reach out to close contacts of positive cases within 24 hours of receiving the lab results. A key to minimizing spread is to stay home if you are sick. That is very critical to controlling the spread. If you have a positive test, you must self-isolate. If you've been tested and are waiting for results, you also need to stay home until you receive the results to potentially avoid exposing others. If you have been identified as a close contact, you need to self-quarantine. Our nursing staff at the health department will provide more specific guidance to those who have tested positive and those who have been identified as close contacts. If you have an ill person in your household, you should avoid contact as much as possible, and face coverings should be worn. Be sure to wash your hands frequently and clean and disinfect commonly touched surfaces. The fifth key factor is evaluating the capacity of our hospitals and the strengths of our entire healthcare system. To determine this, we look at the total number of patients hospitalized, the number that are COVID-19 positive, and the availability of ICU beds. Lincoln's hospitals remain healthy overall. However, we've seen a slight increase with regard to hospitalizations and ICU bed use over the past 2 weeks. We have seen the number of hospitalizations of COVID-19 patients increase from 9 on July 5th to 22 earlier this week. Today, the hospitals report 15 COVID-19 patients. 7 are from Lancaster County and 8 are from other surrounding communities. Most of our indicators are showing signs of leveling off or improving, and a downward trend is beginning to emerge. But we continue to be at high risk for the spread of the virus, so the COVID dial will stay in orange. We want to remind everyone that information is now posted with the dial on the website that explains all the factors that we look at when determining the position of the dial. We have had some questions about whether we are seeing any positive impact from our most recent directed health measure that went into effect July 20th. Our data do indicate what appears to be the beginning of a trend in the right direction. The average number of daily cases was up to 48 in mid-July, and since the mask mandate went into effect July 20th, we have not seen a continued increase. Thank you.
Thank you, Director Lopez, and thank you to the majority of people who are doing the right thing and following our community's directed health measures. We also want to thank the vast majority of businesses that are stepping up and doing their part to protect the public's health. That includes several businesses that were temporarily closed a couple of weekends ago for a 24-hour period. Our health officials worked with those businesses to implement safety measures, and they have all done a good job and remained in compliance, and they're open. That's our goal, to keep businesses open with measures in place that keep their patrons and employees healthy and safe. Finally, we want to share some positive news today. I joined a group today at 27th and Capitol Parkway to accept a $200,000 donation for the project to renovate the Bicentennial Cascade Fountain, also known as our Teacher's Fountain. That very generous donation came from the Downtown Lincoln Rotary Club number 14, which has contributed to so many worthy causes in our community. In fact, it was mentioned at the ceremony today that that very Rotary Club gave some of the initial funding to construct Lincoln General Hospital back in 1920 because of the recent 1918 pandemic. If you'd like to find out more about the Cascade Teachers Fountain project to restore one of our city's icons, you can visit the website at the Lincoln Parks Foundation, lincolnparks.org. You can even buy a brick to honor your favorite teacher. It'll be so nice, I think, for all of us to be able to honor the educators in our community, who I think it's safe to say we all appreciate more than ever before. In closing today, thank you for joining us. Thank you for being among the growing number of heroes who are wearing masks, washing their hands, and watching your distance to protect friends, family, and neighbors from COVID-19. You are the reason we will get through this together. And with that, we'd like to open it up for questions from the media.
Mayor Riley Johnson from the Journal-Star.
Hey, Riley.
Hi, I'd like to ask, earlier in the summer when there was violations of the curfew, the police gave people a little bit of time to vacate and then their arrests were made. Here we have a case at Madisons where they're in violation of the city's directed health measure and in order to close, violating city ordinance. And to date, or to this moment, there has not been police action at Madisons. What's your response, to them going to be? Why are you continuing to let them violate the order?
Riley, our first and foremost goal has been to educate and to work with our community. We know that this has been a very fluid situation, that directed health measures have changed over time, and our primary goal is to keep everyone safe and healthy. And so we've been working with the public. This is obviously an unprecedented situation where someone has not been eager to work with us to keep our community safe. And for the rest of your question, I'm going to turn over to our city attorney, Hansi Christie.
Thank you. I would just echo again that these are unprecedented times, but I would also point out that the situation that we're dealing with Madisons and the business is, as we stated early on, we were treating it as a civil matter. The other situation that you referenced was not exactly a civil matter, so they're handled differently as well.
Colburn's order sort of direct the city to involve its police powers to enforce the violation of a curfew, or of a violation of the directed health measure.
Yes, I think that the ruling yesterday clearly outlined the city's authority to resolve this matter using law enforcement. That's correct.
Does the city plan to do so today? Closure order?
Our first step at this point, I think we're going to have to issue a citation for the business owner, to the business owner for remaining open yesterday. Further action will be taken should the business continue to remain out of compliance. But again, I just want to emphasize that what we're trying to do here is have everyone in the community, business owners, comply with the directed health measure. The business would simply need to provide a plan to keep customers and employees safe, and that plan would need to be approved by the health department.
This is Andrew Ozaki from Channel 7 News out of Omaha. Did the
Sorry,
city...
Andrew, just wanted to add one more thing to Riley's question, and I'd be happy to take yours after that. I just want to make it clear that we did receive outreach from Madison's attorney today, and they called to discuss how the business could remain in operation. So we decided to give the business that opportunity to work with their lawyer to develop that safety plan that the health department could approve. So we expect to have a plan later today. And if we for some reason do not, of course, we will pursue further action, because our goal is to keep the employees and the patrons and our wider public safe. Okay, Andrew.
When do you expect to issue a citation?
What was the question? When do we expect to issue the citation?
Yes.
Today.
And why have you told police not to go in and I guess, investigate any more violations? I guess there have been some complaints already today. The person that filed the complaints was told that the police were not going to respond to any more violations at this particular business.
Andrew, I'm sorry. I don't know what the connection is. I had a hard time hearing your question and everything that you said. If you could repeat it, please.
A person who said that they complained to the police about multiple violations in there today was told that the police were not going to come. They were not going to investigate any of these particular violations or shut them down at this particular time. Well, why was the police told not to investigate any more violations?
Well, I mean, what I can tell you is I don't know who that person is, and I don't know what officer that is. Obviously, I wasn't there. I'm not aware of that, and so I don't know that I could speak to that specific instance.
Let me ask, has the police been instructed in anything about investigating additional violations at the billiard place?
Have they been instructed? Is that what?
Yes.
Again,
has there been, what's been the instructions?
Could you repeat it?
Yeah. What has been the instructions as far as police involvement in anything? As far as the billiard hall right now, have they been told not to go there at all? Have they told not to, have any type of presence in that area?
We have not instructed them to to not go there or anything like that. Again, at this time, what we are doing is working with the business, at least allowing them that opportunity to submit a plan to keep customers and employees safe. So the law enforcement is aware of that.
What would that plan entail?
I think I could probably let Director Lopez speak to that.
Hi, Andrew. We've provided Madison with an example of a plan that was put in place that was reviewed by the health department. And the plan involves the ability to have physical distancing, to have parties of 8 together, seating at the bar, and it also, of course, includes the mask wearing, making sure, just like, you know, this is a place that serves food, and so all of those other requirements for a food facility are requirements there. But this part of the plan really talks about the physical distancing, and we've helped several other places here in Lincoln do the same thing.
Director Lopez, Riley at the Journal-Star. Can I ask a follow-up off of that? Does the health department staff, does a violation of the directed health measure jeopardize the other health department permits that a business holds, such as the food handler's license? Could a violation of the directed health measure also jeopardize their food handling permit?
Well, there's some direct correlation to the directed health measure. It could. But generally, that's not anything we've experienced.
Director Lopez, this is Bill with 1011. It's now been 6 days since they were initially ordered to close. Is there not a fear that by not using law enforcement, as Judge Colburn suggested, that you will then entice other businesses to also disobey the mask mandate?
You know, Bill, I'll let our city attorney answer that, but I don't believe I've heard anybody say that we're not working with law enforcement and that we do expect the business to comply. They have to comply.
Thanks, Bill. I would just point out a couple things, I guess, in response. First of all, the ruling we received was yesterday. And as we stated earlier, further action will be taken should the business continue to remain out of compliance. I would also just take a moment to acknowledge and emphasize again that these are unusual times, right? And I think that you and probably watched the court hearing, as lots of people did, and you can see that the judge had a shield on, covering his face. There were lots of people, everyone in the courthouse had masks on. There's plexiglass in the courtroom. You walk around the courthouse, the entire court staff will have on masks as well. Things are unusual right now. There's not a roadmap for this sort of thing. The city allowed this business owner the opportunity to be heard in court, and the business has been heard.
What will that citation look like? That would not come with an arrest or anything, correct?
Correct. At this time, there is not a plan to physically arrest people. A citation is an order to appear in court, be set for arraignment. The goal all along was to not arrest people. We want people to comply with the directed health measures. We want the community to be safe.
And would that citation be the $500 fine with the possibility of up to 6 months in jail?
Correct.
Mr. Christie, Riley at the Journal Star. I had a sort of follow-up from a loose end in that court case on the injunction. J.L. Spray had kind of made the argument in court about the sort of authority of Director Lopez, and sort of seeking to undermine or invalidate her signature on the DHM because she's a consultant of the city and hasn't been confirmed by the county board and the city council. Is there any concern in the city attorney's office about her authority and or any plans to seek her sort of permanent confirmation to her post?
No, there are no concerns in the city attorney's office. We are confident in Director Lopez's authority. We are confident in the procedure and where we're at with things. While I'm not going to, litigate that particular legal issue in the court of public opinion, I think ultimately that could be something that would be talked more about in court. But no, we're confident.
Mr. Christie, Andrew Ozaki from KTV again. So let me get this clear. There are no plans to shut down or forcibly remove any patrons or close down Madisons.
I believe what I said is that there will be further action will be taken should the business continue to remain out of compliance. And so again, where we are at right now is that the business has the opportunity to submit a plan to the health department.
But that is an option.
Yes. Option to shut down the business, you mean?
Correct.
Yes, I think that, as was referenced earlier, I think by one of the questions, I believe the court ruling yesterday made that very clear, that the city has the authority to do that.
Mr. Christie, this is Brent with Channel 8. You said if they don't come up with a plan and they remain out of compliance, these steps will be taken. Do you have a timeline for when the steps would be taken? How long they could remain out of compliance before you act?
No. I mean, the plan is today, but beyond that, no, I don't have a specific timeline other than today.
Mr. Christie, is it fair to say that no matter what, this business will not be shut down today?
I think that it's fair to say that we are waiting for a plan today. Depending on what happens, further action could be taken, which means that all action or all options would be on the table. The city certainly has authority that was outlined by the court ruling and other options as well.
And
Mayor, I'm sorry. Go.
It's just a quick one. And they were to give you that plan by this evening. Is that correct?
Yeah, yes, today.
Mayor, this is Andrew from Channel 7 again. How worried are you about the optics of closing down a business that's already been hurting for so long?
You know what? I am not concerned about optics right now. I am concerned about the health and safety of our community. I'm concerned about keeping schools open, and I'm concerned about our economic recovery. And this conflict is small compared to what's at stake. But let me make it clear. We are taking these measures not because we enjoy them, but because they are necessary to try to prevail over a virus that doesn't care if we are tired of living with restrictions on our daily life. We are connected. Weak links in the chain affect us all. We do not have community transmission of virus contained. We are at high risk of transmission of COVID-19 in our community. We have the power to mitigate that spread. It's why we put in the mask requirement, and we're pleased with the progress we've made since that mandate went into effect. We know that keeping physical distance from one another is another key strategy for protecting the public's health. We know that staying at home as much as possible to provide that kind of distance and prevent the spread is also effective. If we have folks who don't want to do these things, they put all of us at risk. They put our schools at risk. They put Husker football at risk. They put the university's reopening plan at risk. That's what I'm worried about. And that's what everyone should be worried about right now. We need everyone pulling together to protect this community. Pandemics are not linear. Our progress depends on conscious choices that we make to stay safe and to protect one another. We don't get to just say we want to be in phase 4 and therefore we are in phase 4. We have to earn it. And we have to earn it together. Anyone who's putting that at risk puts us all at risk. That's what this is about. Please, everyone in Lincoln and Lancaster County, wash your hands, wear a mask, stay away from businesses that aren't doing that, because you put yourself and your family at risk and you put the ability of kids to go back to school at risk. And our economy depends on having care for our children. We have doctors and nurses and teachers and public health professionals and business owners who need care for their kids in order to run their businesses and to provide health care to our community. Don't you want that? Don't you want to be able to access health care? Don't you want to be able to go back to school? Don't you want to have businesses open? I'm confident that you do. That is why we need people to comply with these measures. They are temporary. They will not be here forever, but they will be in place longer if people don't make smart decisions. So, yes, this is a small conflict. We will get through it. We will get through it together by more people looking to make smart choices.
Mayor, we have a question from Jeff Robb. He asked if you could address the impact of Lincoln's mask mandate on cases and the spread of coronavirus. Is the mask mandate working?
We are encouraged by the trends we've seen since the mask mandate went into effect. We heard Director Lopez address that in her remarks, and I'll let her speak to that in more detail because she is a public health expert and professional.
Thank you for that question. We have had some questions about that, and I was mentioning that our data does indicate that we have a trend moving in the right direction. The average number of daily cases was up to 48 in mid-July, and since the mask mandate went into effect July 20th, we've not seen any continued increase. In fact, we've seen a decrease. And our positivity rate has also shown a decline. So we've gone from a high of 8.4% the week ending July 25th to 7.2% last week. And we're around 6.4% this week, which is really a major change. The bottom line is we are seeing fewer infections. And this does suggest that our new directed health measure that included the mask wearing has really contributed to the decline. We're monitoring this really closely. We want another week of data, but what we're seeing so far is that there is a relationship between mask wearing and the probability of a decrease in infection. So we'll be able to report more out to you next week.
Hi, Pat.
Hi.
Hi, so sorry. My name is Ashley. I'm over with Channel 8. And I'm just curious, on the topic of mitigating future risk, Omaha Public Schools just announced they will be moving completely remote. Lincoln Public Schools currently is on schedule. Do you anticipate any future conversations happening with that, though?
You know, we're in constant communication with all of our schools in Lincoln and Lancaster County. And I think what they've been sharing with their parents and students is that, you know, we will make changes as our environment changes in the community. And if we have to adjust to different styles of learning, we're going to do that. We're all working together and we want to continue to move forward. And I think the mask mandate is another tool in our toolbox that we put in that we're seeing some positive changes. You know, and I do want to comment, you know, I talk all the time with our other local health departments. And in Omaha, for example, I was just on a call with them this morning. They're seeing an average of 158 to 150 new cases every day. And so for their population, they're in a much different situation than Lincoln is. And that's why it's so important, as the mayor said, that we follow these directed health measures and we do these things that we can all contribute to, because it is making a difference and it's going to help us keep our students in school.
Any other questions?
Mayor Riley at the Journal Star with a non-COVID-19 question.
Thank you.
Awesome. I'm just curious if you had a comment about the New Americans Task Force winning the Google.org Impact Challenge Nebraska Public Choice Award, which seems like a mouthful, and the additional $125,000 to go along with that $175K received last week.
I'm so proud of our community. We are a welcoming community. We have worked hard to try to help people seamlessly integrate into American life. We are proud to be home to so many refugees here in our community who have become new Americans who are contributing to our local economy and to our culture and to our vitality as a community. We continue to receive grants and recognition for that. It's really putting us on the map, but most importantly, it's just wonderful to have these resources to make the quality of life here in Lincoln even better. Congratulations to all the team from the Lincoln Commission on Human Rights to the other nonprofits in our community who worked so hard to make that grant application excellent, to provide the kind of excellent services that are being recognized by Google. We are fortunate in Lincoln to have so many caring individuals who are making this city a better place to live, work, and play. Any questions? Right. Thank you. Thank you for tuning in. Thank you for doing your part to help us mitigate the spread of COVID-19. We will get through this together, and we appreciate your efforts. Stay safe.